A major concern during this time of the year is mosquito-borne diseases like malaria, dengue, chikungunya, and also water-borne diseases like typhoid and hepatitis A. This report is going to give you an idea about recognizing and identifying these diseases, their symptoms. Keep yourself and your family safe.
The floods.
Anybody whose houses beat water, stay here. Frogs were jumping around,
Right.
and I am sure snakes must be there.
And then the risk of several infections. The water levels have receded, but fears of dengue fever caused by the mosquitoes breeding in dirty and stagnant water remains. During the monsoon season, increased rainfall leads to water accumulation, creating breeding grounds for mosquitoes. Additionally, stagnant water in containers, discarded tires, and open drains become a hotbed for mosquito larvae. As climate change continues to impact our planet, the incidence of mosquito-borne diseases is expected to rise. In fact, a disease usually seen in tropical countries is now even being seen in Europe. How can India, with the perfect climate for mosquito breeding, be spared then?
So it's a mosquito-borne viral infection, and the temperature and the climatic conditions in India are very congenial for the virus and the mosquito to multiply. At the same time, at the moment, we are experiencing a tremendous climate change, and with the unexpected floods and the rains, it is also propagating the multiplication of the virus and the mosquitoes, which are the Aedes aegypti mosquitoes that transmit the dengue virus.
Dengue is a viral infection that spreads from mosquitoes to people. It is more common in tropical and subtropical climates. Most people who get dengue won't have symptoms. But for those who do, the most common symptoms are high fever, headache, body aches, nausea and rash.
The signs that are warning signs, which are the ones to really look out for and to hospitalize, include a severe pain in the abdomen, tremendous vomiting, unable to take anything orally, breathing difficulty, drowsiness, or a bleeding from the nose or the teeth or gums. Otherwise, majority of the patients actually in dengue are asymptomatic. They may not really get any symptoms.
Diseases that raise their ugly heads in monsoons are typhoid, cholera, hepatitis A, dengue, malaria and chikungunya. Here is some advice.
So most importantly, eat healthy, home-cooked, nutritious food. When you're eating outside, especially street food, eat only things which are well cooked and avoid raw fruits or raw stuff when eating out. Water has to be filtered or boiled. Avoid going to the swimming pools at this point of time because you may pick up an infection. And lastly, it is important to update your vaccinations, whether it is for typhoid or hepatitis A or influenza. This is a time that you should look at your vaccination record and update yourself.
Work on building your immunity and take these basic safety precautions. With Akshay Dongre and Sneha Mordani, Bureau Report, India Today.